Good morning, everyone, and welcome to UroNurse. We meet every Saturday at 9 a.m. Central Time. If you're joining us on YouTube or on Facebook, great, glad to have you on board. And be sure to hit that like, subscribe, Facebook, whatever they have, but be sure to hit those buttons for us. Hey, if this is your first time checking us out here at UroNurse, be sure to go to our website at uronurse.com to find out more information about the show and how you can become a part of it. Also, that's our best place to go for all of our previous episodes. Yes, all the episodes are available on demand, and we've got 37 of them. We'd like to thank our sponsors for sponsoring the show, and if you're interested in information on how you could become a sponsor, click that sponsor info button. We'd love to have you on board. No matter how you're watching the show, if you're watching us live, it's your questions that really drive the show. So be sure to submit your questions through the comments. And that includes Facebook people and YouTube people. All the comments will come in. We'll be able to answer any of your questions live. We're always glad to ask good questions. And speaking of good questions, we've got a great show coming up for us today. We have Katherine Marchese, who's going to be talking to us about certification. Katherine Marchese was the past president, or still is the past president, of the CBUNA organization. That's the certifying agency. So it's best to go right to the horse's mouth when you want the best information. So we're looking forward to that. And at this point, we're going to go ahead and bring in our experts. 1 second while I make a few button changes here. And there they are. Wow, that worked. Sometimes I impress myself. For those of you that are new to the show, and I saw a few new names, so I'm glad to have some new people on board. Welcome. My name is Vic Sinise. I'm the producer and host of the show, and I did this as a way of paying it back to a profession that I've spent a lot of years in. So I'm glad to have everybody on board, and we're going to go ahead and have our panelists go introduce themselves. We'll start with Andrea. Go ahead and give us some information about who you are and what you do.
Hi, my name's Andrea Strong. I'm a urology nurse practitioner in Wisconsin in the academic setting. I've been a urology nurse for many years now, since 2010. I've done inpatient, I've done outpatient. I'm also a certified urologic registered nurse, and I look forward to hanging out with y'all today.
Yeah, great. And Kathy, go ahead, and our guest panelist, tell us a little bit about yourself.
Katherine Marchese. I've been in urology a little bit longer than Andrea. I started back in 1989, worked as a nurse for years, and then in 2008 became a nurse practitioner. First, I was certified as a certified urologic nurse, and then when I finished my NP, I went and became certified as a nurse practitioner. And at that time, I met some of the people from the CBUNA board, and I was asked to join the board. And I think I've been in it for almost like 10 years. I just retired last year. So I'm pleased to be able to talk about certification and encourage you to do it yourself. Thanks.
So I just realized that I've been involved for 4 years longer than you in urology. I started in 85.
You did? Wow.
Yeah.
Wow. You're also younger.
Hey, John, a little introduction too.
Hello, everyone. I'm a private practice urologist in Gilbert, Arizona, who, like Vic, wants to pay it forward by sharing my experience in the business of medicine to benefit my colleagues. To that end, I created the Thriving Urology Practice Facebook group, where over 2,200 US-based urology practice personnel collaborate to improve our practices, and it's all for free. And as they say, if it's free, it's for me. I look forward to our knowledge exchange. Back to you, Vic.
Yeah, great having everybody. Hey, we're going to go into the next part of our show where we ask any questions that you guys may have, general questions. Feel free to put those through on the comments. And we're going to do our favorite stories. Now, I'm going to start off and kick it off with the favorite story here. So let's bring it in here. My favorite story has to do with certification. Now, Kathy's going to talk about what's involved in getting certified, but I got certified way back when. And I think it was every 3 or 5 years, something like that, you had to recertify. And the requirements to recertify was to take the test again, or you could do some kind of work project. And I was going to have nothing to do with the work project. Now, thankfully, you don't have to do the work projects anymore. You can just take your contact hours and use those to recertify. But I not only passed the test once, so there's proof that you can go ahead and pass this test if you really want to put yourself to it.
And luckily, most people don't. Most people realize it's much easier to just do 36 contact hours and recertify, right?
Oh, yeah. I mean, I would have
Study
recertified
'em.
or taken the test 9 times by now. So,
Yeah.
hey, Kathy, maybe you could talk a little bit about. So, Kathy and I have known each other a long time, and the Chicago Metro chapter was actually started by Kathy and I. So, maybe you can just tell people what's the best way to start a chapter, because you really kicked it off.
How did we start it? Well, actually, it was a group of about 4 of us, and we had just where we were actually at one of the national conferences, and there had been a chapter years before, but it had disbanded. And we were very interested in education that was offered in our area. And you get 4 people together that are interested in that. And a couple of us were in academic centers, which makes it a lot easier because we have a huge pool of people that believe in education, and they were willing to, sponsor talks for us. And then Vic has always been a strong advocate in pulling the industry in. And so we were able to get financing to help support our chapter, and put a lot of work into it. We started doing like monthly conferences, which were like an hour. We arranged it to be like after work so that people could come. We used a mid-center area so that people from all 4 directions would, have a short commute to come into it. And then we moved into having a 1-day conference, and then I coerced people into doing a 2-day conference for a while. And then we backed off on that, and we're back down to like a half-day conference.
Yeah.
A couple times a year.
And I have to credit Kathy with being the force behind, literally the force behind us. She says, "Come on, I know we can do this. Let's get it done." And the best way I think to get people involved in a chapter always starts at a bar.
Yeah.
A
lot of alcohol. You agree to everything. Oh, that sounds like a good idea.
We always loosen them up.
I will say that one of the things that I like best about forming chapters or being in a chapter and being active in a chapter, you have an amazing group of resources. And if you ever have a question, there's always somebody within your area that you can just call up. And to say nothing about the fun in doing all of it too, but the availability of resources was amazing.
Yeah. It definitely was. Having the experts, within our own group, really big.
Right.
Hi, John. I know you always have a great story for us.
Well, working in urology, there's never a shortage of content, if you will. and having done thousands of vasectomies just in the last couple of years, there's always an outlier. There's always something that happens. And it was a story of a 36-year-old guy who had a vasectomy a couple of years ago. And he was one of those compliant guys. He actually followed up and had his post-vasectomy semen analysis. And that showed no sperm. Wait, my arm is not long enough to pat myself. No. He showed no sperm. It was successful, as usual. But then he came back later and had a repeat semen analysis. Now, that's always a little suspicious because once you test no sperm, you're usually good. So he had another semen analysis that showed, again, no sperm. So that piqued my interest. I said, why did you have it repeated? He said, well, after my first semen analysis that showed no sperm, now my wife says that she's pregnant. So there are many ways to look at this situation. Yes, you can have the tubes reconnect even after 2 semen analyses showing no sperm. But what are the chances of that happening versus something else happening? So I said, well, after a semen analysis showing no sperm after a vasectomy, the only thing that changes is the color of the baby. Back to you, Vic. So I don't really know what happened with that situation. I did not pursue it. In the past, I have called guys up and said, hey, your semen analysis again show no sperm. What happened? And one of these guys said, it's all good. I said, what do you mean it's all good? He said, it's all good.
And
So
that was it. Yeah.
I don't pursue it anymore.
Yeah, I had this similar situation with a patient who came back that said, hey, can I have another check of my semen sample? And of course it was still negative. And he later called me back to say, yeah, the UPS man was delivering more than packages. You just never know.
Goodness.
Andrew,
kind of a package.
do we inspire a story from you?
Yeah, excuse me. I'd like to share my certification story. So I'm certified as a urologic registered nurse. I'm not yet eligible to be a certified nurse practitioner, but I hope to take that exam in the near future. It was 2015, and I'm so fortunate to have worked with so many amazing mentors in my life, including Katherine Marchese, who I was working with at the time. And she has a very positive, Vic said she's got a lot of energy, very positive energy, and really encouraged me to do that. And I did. So as far as studying, if you're interested in doing that, I did 3 months, about an hour every day. There were resources available online. Those resources may have changed now. So I don't want to share the resources that I used back in 2015, because I'm sure there's updated resources now. But if you go to the CBUNA website, there's a lot of material on how to study and study guides and everything. So I used those, took the exam, got certified, and it was a great feeling. And I think it really helps you enjoy your job more when you feel really confident about what you're telling the patients and your practice. So I really encourage you to think about getting certified if you're considering it.
Absolutely.
Along the same lines of certification stories, and being a close chapter, when I was telling the chapter that I was going to go for certification, I remember Vic especially saying to me, now, read the question carefully. Don't think about what you do in your own practice. And as I'm taking the test, I'm like reading the question. Okay, Vic said, and I swear probably at least 20 questions out of that test, I was like, okay, now let me see. What did people say about what not to do? And half of the people said, don't go back and change your answer. Stick with your first answer, because that's usually your gut reaction, and go with that. And yeah, it was great. I can't say enough about you guys trying to get active in a chapter. That would be the best thing to do.
Oh, great.
Well, I hope to hear from Kathy regarding what is CBUNA and what does it do, because I have no idea.
Okay, so CBUNA is the Certification Board of Urologic Nurses and Associates. So we write the test questions. We have task force groups to do what we call a practice analysis, which helps us determine what the different levels of nurses are doing. So, we test associates, which are like medical assistants, people who work like in research, they can do that, regular nurses, and then nurse practitioners. So, yeah, it's a big commitment, but it's very enjoyable.
Yeah. And similar to urologists taking their boards to show their expertise in urology, we're taking a similar type of board to show that we're expert in urology nursing. So,
and interestingly, a historical thing is that our certification used to be urologists giving us an oral exam before we would pass. It was like a 2-day event or something like that. It was pretty intense.
That was before my time. Yeah.
Oral boards. Yeah.
It was pretty frightening in those days. Yeah. Yeah.
Well, and the AUA had a lot to do with when CUNA formed. They were
right.
Like at one point.
We used to be called the AUAA.
Right.
Yeah. and then
So
we
they-
split from them.
Yeah. All right. Let's see. I did get somebody's got a comment here. Monica sent in, are there any other certifications for urologic RNs?
And that answer is no. We are the only certification for urologic nurses. And, you know, a couple of years ago, we were accredited by the ANCC. So we are the highest level of accreditation for urologic nurses, or for, you know, any kind of nurses. So we're pretty proud of that. We worked hard to get that.
And Monica says, thank you. Good answer. All right. If there's no
Are you certified?
Oh yeah, Monica, are you certified? And anybody watching, let us know if you're certified. That's kind of an interesting thing to know. Or thinking of taking the test, feel free to put any of those comments in there. I don't see any other questions coming up, so I'm going to start getting things rolling for the show to get Kathy's presentation going. Not yet. Now we know why Monica's watching. She's going to see if it's going to be doable. We're going to make sure you know that this can be done. It's easy. What do they say? Easy peasy.
Yeah.
And Neil just put in here, applying to test soon. Great,
Right.
Neil. I hope we got some good hints for you coming today. All righty. Let me just kick this banner out here.
While Vic's doing that, Neil, there are scholarships available. And so don't hesitate to apply for them.
Oops. I want that one. There we go. All righty. Well, Kathy, take it away. It's all yours.
Okay. So now you know who I am. The big question is, you know, why do people want to certify? Is it for money? Because do you think that you're going to get a big raise? Most likely not. I would like to, you know, hope that that would be some institutions now with the magnet status, they will give you a little boost in your pay. Is it glory? It's like personal glory, just like Andrea shared. There's this feeling that you get like, yeah, I've got this. I know this. I am one of the experts. What about prestige? So a story about that is when I first started in urology, I was doing a lot of urinary diversions, and we had ET nurses in the hospital, which were endosomal therapy nurses. And I was not an ET nurse, and they had very little respect for me as far as when I would, you know, be doing the urostomies and teaching on that. And they would say to me a couple of times a week, well, I think that, you know, your department should, you know, use us to do that because you don't really have the experience or the knowledge. So I just took that as a challenge and, you know, went to the program, and so became certified as a wound ostomy and continence nurse. And it was amazing how the outlook of people all of a sudden changed me, because now I was experienced and I was certified. And they started using me as resources for their urostomy patients. So yeah, there is a certain amount of prestige with that. Is there a job requirement? Well, again, as I mentioned, with the magnet status, a lot of the hospitals are requiring and encouraging nurses to get certified. So certainly we would love to have nurses in the urology field get certified. But I'd also like to say that general med nurses can also do this, because so many of our conditions are seen in the medical practice. You know, urinary tract infections, BPH, erectile dysfunction. Almost everything that we do is seen by a general practitioner first. So you've got nurses in the clinic that if they had that basic knowledge, it would be wonderful for them. So is it a job requirement? I would say not necessarily, but people do appreciate having someone that has that experience. So basically, the reason that you're going to do a certification is because it validates who you are. It validates that you've put in that time and that energy. And number one, that you really care about these patients, that you've got interest in seeing them from the beginning of their care with us through their lifespan. And then basically it's a testimony to how hard we work, and that we have specialty and we have, you know, a specialty knowledge in taking care of these patients. As I mentioned to Neil, there are scholarships available, and it's amazing to me how many people don't even think to apply for them. So please do. People will always say, well, I'm going to save that for someone who doesn't have the resources that I do. Or, you know what, I'm not smart enough to qualify for that. So selection is not based on your finances or how smart you are. It's people who have an interest in staying in the urologic field and want to provide quality patient care. So please apply. I listed the one that we have available here right now. It's the Jan Louboutin, and the requirements are listed there. The other thing that I want to add is if you go to the national conference, our certification, our testing agency will usually offer a scholarship in the silent auction that is done. And the testing is anywhere from $300 to like almost, I think, $450. And so it's an auction thing, and people rarely will bid all the way up. So you'd get a discount by doing it with that too. So please apply. So we want to talk about how do you prepare and how long. And Andrea mentioned about 3 months, and that's about the average. So when we were talking with different groups of people, we decided to kind of come up with a list of what people found important. And so when you take the test, there is something called the McFarland Award that gets given to the highest scorer. And so what we decided to do is to publish their accomplishments in the paper. It was the Urogram. And we would give them a list of questions and ask them to kind of fill it out. And basically it was, can you just tell us some of your hints and some of your secrets? And so these were some of the things that they talked about. 3 months was about average time. Spend more time on the areas that you know you're weak in. So we have some nurses that don't practice in a full scope area. We have like a lot of female practices only. And so those women know nothing about BPH. So of course they need to spend more time on that. But as far as the incontinence and some of the gynae issues, pessaries and all that, they have that down pat. So I recommend like identifying some of the areas that you are weak. And then, you know, I know we all do things differently. I was always a big outliner. So I would read a section and I would outline it. And then what I would do is I would go back and first review the section that I had done the previous time. I don't think everybody is as strong as a study person as Andrea was. If she was spending an hour a day, I think maybe that's more than most people were giving to it. But Andrea did really well on the test. So the idea is to set up a schedule that's going to work for you based on, you know, what your outside things are. If you got young kids, you're still in school, that kind of stuff, you're going to, you know, have to set up something that's going to work for you. But then stick to the schedule. And that's one of the big things that people said is that they just had to make that commitment that, you know, Friday night from 7 to 8, come hell or high water, they were going to sit down and they were going to do that studying. The other thing is you have so many sources that you can use in your own practice. We've always found that the physicians are interested in their staff becoming certified, and they love to answer questions. If you show that you're interested in learning something about it, it's to their advantage to share their information with you. And it's amazing what you can learn just by asking questions at work. And then remember that your other coworkers have gone through the same thing too. I recommend that you try to find a study partner. Someone that you work with is always easier because you don't have to travel any place to go find somebody. And one of the things that we were talking about with the McFarland winners is they had frequent strong chapters. And sometimes the chapters would actually say, we're going to do a certification study group. And so like 5 or 6 people from the same chapter would go ahead and study together and kind of challenge each other. So one of the things that you want to do when you're working, try to think about what you don't know. So an example, that I give frequently when I'm talking about certification is a lot of nurses don't really focus on the TNM staging, and that is definitely always on the test. And let me just preface this with, I am not allowed to talk about anything specific on the test. So when I am making these statements, this is just generic information that we share in our study guide too. So I'm not giving you guys any secret information or anything like that. That would be unethical. But so we suggest that you learn the TNM staging. And so when you're putting a patient in the room and he's got prostate cancer, look up his pathology report. And so kind of learn that, oh, if the seminal vesicles are involved, this is one. If it's both sides of the prostates, this means something. If the nodes are positive, if they have lesions outside of the area, like in their, spine or something, that's information you're picking up, and it's not part of your study guide material. You're just learning it, and it's useful for you in the daily practice too. Another one would be like incontinent meds. So such a huge percentage of women are incontinent, and so you want to know what medications they're on and what the side effects are. So just taking a little bit of time when you're rooming them in and finding out, do they have any side effects of the meds? How is it working? Just part of it's just for your own personal knowledge, and then you can chart it. I always had a thing about nurses that would just put their entrance note was here for follow-up and then walk out of the room. You're really not helping the physician at all with that kind of a statement. So, learning about their meds and what their side effects are can actually help save some time with their physicians. All right, so what are the best resources? I think the first thing that you always want to do is you want to get on that CBUNA website. There is so much information there. It's going to give you a lot of specific detail on everything and kind of help you get prepared for how to do the application. We have something on there that's called the exam preparation guide, and we spent so much time developing this. There is a pretty detailed outline of what we consider to be important points, and then you can use that as your basic outline. The prep guide is $38, so it might seem like it's a lot, but especially if you're studying with groups, you can buy one and just kind of copy it for people. What this contains is the blueprint of what the exam is, and I'm going to go into that a little bit later on, but it's going to tell you again how many questions are going to be on which topics, so you can focus on some of the areas that you're not familiar with. There's also sample test questions, which is always helpful for you to learn. And by the way, when we are writing the test questions, there are no trick questions. We are not out to try to make you fail. We want you to succeed with this. That is our goal. And our certification pass rate is really high for like the year 2022, 100% of the MAs that took the test passed. The urologic nurses, I think, were in the high, I think they were in the high 80s, and the nurse practitioners were like in the 90s. So it used to be when we first started, the pass rate was in the 70s, and we've really worked hard to adjust the test to reflect what nurses actually are doing in practice. And I think that's helped with our pass rate. There is also a certification review class that is offered at the nursing conferences that we have, and you can also do it online. Now, what that is, it's I think it's about a 4-hour review course where they kind of go through and give you a little bit more idea about how to study, what particular topics, and it gives you a format for you to identify what you need to know. A lot of the McFarland winners actually took the certification review course the night before they actually took the exam, and they felt like that kind of helped them go back and just focus on some of their weak areas that they would actually study the night before the exam. All right, so I've listed a couple of the clinical references here, and the first one is what we call our core curriculum. When we went for our ANCC accreditation, we had to be able to list that we had a body of evidence that was specific to urologic nursing. And that's what the core was. And that took a few years for us to get that written. CUNA involved a huge group of content experts, and they wrote really detailed chapters. And to be honest, that's one of my favorite books when I tell people to study, because it's just got everything you could need. I highly recommend that. We are actually in the process of rewriting it and updating it. That's probably not going to be available till maybe next spring, because it's amazing how much work that is to get that done. And then the other thing I wrote down was the nursing drug reference book. And, this is just one we use. It doesn't matter which pharmacology resource you use, but just make sure it's a current one. You can see this one says 16. I'm sure the board is going to be updating that. We try to keep the resources within 5 years. We try not to use anything that is older than that, because information could be outdated. And then we also suggest that if you are not a member of CUNA, you join so that you can get the journal articles, because we'll take a lot of the test questions out of the articles that are found. And it's just kind of nice to have that as a resource too. It'll help you identify some areas that you might not be familiar with. And then probably a big resource that even if you're not preparing for the certification exam is make use of the AUA guidelines. That is so important that we base our practice on the guidelines that are recommended, and they don't have it for every single disease entity. And John, if you want to speak about that, later on, that's great. But I find this to be a great resource. It's very, very detailed. It gives you a good basics on as a study guide on what you need to know about, something like, let's say, hematuria. All right, so this is the blueprint on the exam. I just use the urology nurse practitioner because that's what I am, but they're basically all set up the same. We have two separate axes. We have the patient problems, and so that's the kinds of conditions that we're doing, and we're basing them on, again, that practice analysis that we did. So we have pediatric anomalies and common neoplasms. And you can see that that's only 8% of the test. And so that is a total of 14 questions. So when you're looking at where am I going to spend my time, pediatrics, probably you're not going to spend a whole lot of time. And a lot of people are worried. They're like, I don't do peds. I don't know anything about peds. Well, we made it easy. Basically, since we're talking about urologic conditions through the lifespan, we're going to take conditions that start out as a pediatric problem, and then the people deal with it for the rest of their lives. And some of that can be like bladder exstrophy. You're going to be following up those patients, for their entire lifespan. Someone with spina bifida, again, pediatric congenital defect, that you're going to be seeing them in your adult practice. So when you see a pediatric question, don't panic. Don't just think, I don't know what that is. Just take out the thing that says, it's a 3-year-old little boy and put in it's a 33-year-old man, and you'll be able to answer the question. That's definitely how we planned it. Another example is the voiding dysfunction sections, so that's 23%. And there's going to be 41 questions on that. So when you're talking about how to spend your time, you're going to focus on those percentages that are higher. There's going to be more questions for you to answer. And just like we always learn in nursing, everything is about assessing and diagnosing, and then what are you going to do to intervene? What are you going to do as far as evaluation? And what kind of education do you need to be teaching to people? And what do you know and what do you need to know as far as to provide quality care? And then so nurse practitioners will do some consultation. So there's a couple questions on consultation, and that would be something relatively simple, like, you were on call in the hospital and a patient came in, with hematuria. what are your expectations? And as far as like a referral, it could be something like the patient needs to have a cystoscopy to see, you know, what the source of the bleeding was because you couldn't stop it with irrigation or something. Or you may find that you get a referral for treating urinary tract infections, or one of your providing internal medicine people will say, I've got someone with erectile dysfunction and I've tried them on the oral agents and that's not working. I'd like you to follow up with them and kind of go over what our guidelines are for accepting consultations, and then, you know, how you get back to them to keep them informed of what you're doing with your patient. And then we have some, and again, look at this, it's only like 3%. So there's not a whole lot of questions on practice management, but there would be things like, you know, consent documents. And if you're going to be in the research study, what do they have to be offered? That information. Okay. Okay, so the certification test basics. So it's a time test. If you're going to test as an associate or as a nurse, you've got 3 hours. If it's a nurse practitioner, it's going to be 4 hours. There are different tests. There are 175 questions for the nurse practitioner, and there are 150 questions for the UA, the UA and the CURNs. All right. It's computer based now. So you don't have to come to one central location. You know, in the past, people from Illinois would have to drive to like Springfield or to Chicago, which increases your anxiety. It increased your cost. You have to pay for a hotel, you know, it was downtown. And the anxiety level was incredible. And now it's offered at over 200 sites in the United States. And we even have international sites when you can do it, where you can take the test. So again, go to the CBUNA website because they will tell you where all the different sites are. All right, here's the thing. Now that it's computer based, don't cheat, because the person next to you can have a different test, even if they're taking the CURN test or the CUNP test, because it's computer based. So the test questions are put in and they're randomly assigned. And so you may see the person next to you's answer for number 2, let's say, and you see, oh, he circled 2, he circled B. Don't just do B because he did, because you could have a totally different question. All right. It's multiple choice. So luckily you don't have to answer any essay questions. You don't have to get any true or false. There's 4 choices. And as you probably are aware, when you are a multiple choice, again, there's no trick questions, but there's going to be a couple of choices that could possibly be right. So I want you to read them really slowly and look for keywords like initially or best. And if you see something that says always or never, you can almost always just knock that one out, because, you know, nothing's absolute or, you know, completely all or none. All right. So when we're writing the test questions, it's a very complicated procedure. It takes us 3 years to write these questions. And I just want to go over it a little bit so you understand the detail that goes into writing these questions. The first thing that we do is we develop a task force for what we call the practice analysis. And that's where a group of 5 to 7 experts are invited to participate in this task force. And it's volunteers. So if you want to participate in a task force like this, contact us at our conference. You don't have to be certified to do this particular task force. But what we do is we get together and we identify what the common things that we do every day in our practice. You know, how many of us are treating erectile dysfunctions? How many of us actually give injections? How many of us see Peyronie's disease? How many are doing female care? And we come up with this master list. So then we list all the activities that we do associated with that. And then we decide, what level of education do you have for that? We send all of this information off to our testing agency then, who does a statistical analysis and comes up with our blueprint that you just saw a couple minutes ago that said, X amount of people are doing pediatrics. And so we're going to have 8% of the questions on that. And then the next stage is where we get a different team of experts and we write the test questions. And we review every test question to make sure that it's still current and that it's valid. And every question is validated by 2 complete resources that are recent. All right. So we'll use the AUA guidelines. We'll use our CUNA core. We use Smith's General Urology, and we use the Urologic Nursing. So we have a lot of options there. And then the last component, and this is kind of a little hard for people to understand. And I know that the first time I did this task force, I was kind of like, oh, this is like a guessing game. It's called the Angoff procedure. And so what you do as this group, you decide that this test question, what percentage of, in my case, nurse practitioners who've been in practice for 1 year, what percentage of them do you think are going to be able to answer this question correctly? And mind you, we want all different levels. So some of the questions are going to be easy and some of them are going to be really tough. And then that's how we come up with our passing score. So each one of those takes a year to do and a year to kind of collaborate it. So that's why we review the test every 3 years. And then we completely redo the test in 5 years. So the one thing that I wanted to say too is that sometimes, different practices do things differently. So I don't want you to, when you're taking the test, and this is something that Vic said to me when I was preparing for it. Remember, you're testing out of the book. You're not testing what your particular practice does, because every practice can do things differently, and it may not necessarily be what the current information is. All right, so here's another nice clue. You always wonder when you're taking a test, should I just answer every question even if I don't have an answer? And that answer is yes. There is no penalty for filling in an answer, but don't just do a A, B, C, D kind of, I don't know what it is. Cross out the answers that are not right. And usually you stand at least a 50% chance of getting it right, because usually you can knock out at least 2. And then I mentioned that, the RN and the CUA are 150 questions. All right, so here's the other little just piece of information that people would always tell you to do is make sure you come early. You never are sure what traffic is going to be like. You're never sure what the parking situation is going to be. Although now that we do computerized testing, testing sites can be pretty small. But you just want to have that time to just sit down, have a cup of coffee, or just like calm down before you go into that test. Wear comfortable clothing, dress in layers. Me, I'm always freezing. So I come with like 3 layers just in case I'm going to be too hot or too cold. All right. You're not allowed to bring in beverages. You're not allowed to bring your cell phones, electronic devices, and you're also not allowed to bring in any of your books or study notes. All right. Here's the best thing. You get all done and you hit the button and it's swirling, swirling, swirling. And then it's going to tell you immediately if you pass the exam. You don't have to wait 6 weeks or anything like that. So I'm hoping that this is going to be the kind of information that you need that's going to encourage you to take the test. Like I said, there's a very high pass rate. And if you study, like we're talking about, it's very easy to pass this test. I don't have anything else to share. So if there's any questions, please ask me.
And that was great, Kathy. Really nice review. And I think it kind of makes us it would make me more comfortable in taking the exam for the 3rd time, And I appreciate all the references to my study habits, because, of course, I did take it twice, so I should know how to do it.
So actually, if you go to their website, CBUNA.org, you can actually see the number of people who retested to get recertified. And it's 1 to 3 every year. But the majority of people just do your continuing education credits. I do want to point out for anyone who's kind of on the fence here, the score that you need to pass is anywhere between 70 to 72% based on the most recent information on the CBUNA.org website. So you don't need to get 100% here. If you've done the education to be a medical assistant, to be a registered nurse, to be a nurse practitioner, you can definitely get 70% on an exam if you put in the work.
I think that's true. Isn't there a requirement of how much time you have to be in urology to take it too?
There is. And I was just going to say, for that, I was just going to have people go to the website for doing that. You have to be in urology 2 years.
Okay.
You don't have the knowledge to pass the test if you don't have that kind of timing in. So it makes good sense. And we chose that because we want success. We don't want you to fail because you haven't had that exposure. And so by 2 years, you've kind of had that experience there. You also have to be certified as a nurse or registered nurse or MA or as a nurse practitioner. Or LPNs will go under the associates. And if there is no certification for your classification, like as an MA, your physician can write that you are a candidate for this based on the type of work that you do in the clinic. So
we do have a comment from the group here. Neil Smith said the breakdown of content percentage was very useful. Thanks. So yeah, I think that was kind of nice to know.
That's why I recommend, getting that book. I know it's $38, but it gives you a lot of valuable information. And I would really pay attention to that because, when we're going through our questions on which we're going to include in the test, we stick within that 23% or, 20%. So go for the high traffic areas and pretty easy percentage to pass.
And one of the things that you had mentioned was about recognition for being certified, and just kind of a funny story. So, of course, I said I was certified quite a while back, and after I got my certification, of course, I told my employers and the group I worked with, the docs I worked with, we were a really close group. Well, one of the guys in particular, the senior member, every time he would introduce me, he'd say, "This is my nurse, Mr. Sinise. And by the way, he's certified just like I am in urology." So, I mean, it can be a bragging point for your physicians too. So I think it's really something that's encouraged to be done.
When I was working in a larger practice, I negotiated with the office that any nurse or associate that got certified was guaranteed a percentage increase in their salary. And it was kind of a nice option for people to consider, like, well, hey, you know what? This isn't just like a one-time bonus. This is going to be something that's going to be added to my salary, every year. So if you can talk your practice into doing that, that's great. Also, the other thing I found is that when you're certified, they're more likely to allow you to go to some of these interesting conferences. I don't know if you guys found that, Andrea and Vic, but that's been my experience because they feel like you've put the effort in.
Mm-hmm.
Yeah.
And you need the contact hours.
Mm-hmm.
Yeah. I think you bring up an interesting point, Kathy, is negotiating in the world of healthcare. I think nurses and nurse practitioners were not great at negotiating. It's not something that they teach us in school, and a lot of us are uncomfortable with it, including myself. So I would really encourage you to ask your employer if there's nothing that's currently in place to give you a benefit. Asking is not going to hurt anything. The worst that can happen is they can say no. And if they can't give you an increase in percentage in your salary, you could ask for other things, such as a one-time stipend. I've worked at an institution in the past where if you got certified, you got a one-time stipend of $400, which is really nice. You could negotiate for an extra PTO day. You could negotiate to go to a conference. There's all kinds of things you can negotiate for besides, an increase in your salary. So, yeah.
And I think that when you're certified, they're more interested too in giving you more autonomy. I mean, and that was always the thing that I was looking for, both as an RN and as a nurse practitioner. I love the fact that I was able to offer a lot of different things in the practice because of the knowledge, that you had. I loved being as independent as I could. And, when I was at Loyola, it was amazing how great they were. I had a great experience. That was really strong. So
I think I'll take advantage of the fact we have a urologist on our expert panel. John, what's your thoughts on your staff? Would you recommend certification for them, or does it seem something important?
Oh, I'm a big proponent for continuing education and being at the top of the game, and also understanding the guidelines. Because once you understand the guidelines, you then know when you deviate from the guidelines, and also you can let the patients know, hey, the recommendations are this, but we are not following it because of X, Y, and Z in your situation.
right.
So knowing what the general consensus is, and also knowing when you deviate from the consensus, and also, of course, documenting that in your chart is an important thing to do.
And it's so well written. It's so organized. I find the guidelines to be a great resource. Yeah.
And I certainly would, as a practice, I would definitely pay for it's really inexpensive. Come on. It's relatively speaking, to get recertification, to help the employee get this certification. It's helping the practice, and it's a business expense. So help him or her do a better job to help your patients so that you can run a more efficient practice.
And you know what, John, when you're talking to all the urologists that you're with, stress that. That would be great.
Yeah.
I think funding used to be a lot more available than it is now. And a lot of times I hear from our fellow nurses that, they're cutting back on sending people to conferences and, paying for things like certification. There's like an endless benefit to both the physician and the nurse. The more educated she is, the better she's going to be too. So
I do have a comment that came in from Neil. It's been a long time since I worked for them, but the VA offered a 2-step pay grade increase for first job relevant certification while I was there. It's financially worth your time in some governmental agencies. So that's good to know. And it's Andrea had kind of pointed out, negotiating for things outside of just always, salary increases. One of the things when I was certified is I said, hey, listen, now in order to stay certified, I've got to go to these educational meetings to get my credit hours. And I said, so I want you guys to, of course, pay for those meetings. That means hotel, airfare, costs of the conference. Well, the nice thing about that, and I'm not a tax accountant, so don't trust my financial statements, but it's not, if you're negotiating for a salary increase, you're going to pay taxes on that. But if the doctor's office is sending you someplace, that's tax-free money.
You don't. Yeah. Is that a write-off for the practice too, John?
Yes, it is.
That's nice
Right.
to know too.
So it's beneficial for them.
Right.
So, Kathy, I did have a question for you. I remember they had this thing, no fear of failure. Is that still there?
I don't. So, I've been off the board now. I don't know that it's still there. I didn't see it on the website because I did check the website for different things. Yeah.
Yeah. For those of you that may not know what that meant, it's for a while, the board was offering, if you took the test and you failed it, you could take the test again. And I think it was at no cost or reduced cost.
Right.
Yeah.
Yeah.
So you could take it a second time. So it was like kind of like a free trial to see what the test is like, because there is a cost to taking the test. And I think 150 or something like that.
There is a slight recertification. I mean, a retake test, but it's still pretty reasonable because they give the people the option that you can fail it once and then you can retake it without like a big commitment again. Yeah. So we want you to have success,
Right.
And I think that if you follow the recommendations of what we talked about, your success would be guaranteed. The options for learning are certainly there. And I think getting a group together to do it, I think it's a wonderful way to do it.
Yeah.
So.
Somebody else had commented, I think it was actually one of our past panelists, Marianne Wasner, when she was studying for taking certification. What she did was she got a lot of the information that Chicago Metro CUNA had on their video library and just listened to the audio part in her car on her trip back and forth to work.
Right.
So
I forgot to mention that. Yeah.
While you're in your car and you're stuck in traffic, instead of cursing, get out your education from wherever and Chicago Metro has a lot of video things that you can watch. Of course, now Uronurse.
Yeah, and I didn't mention that too, but the library from CUNA has all of the article or all of the conferences online, and you can always purchase those and do them on video if you want, driving to and from too. Hopefully you won't be crashing into people because you're listening to that and not paying attention to the road.
There are some AUA podcasts as well. There's a lot of urology podcasts really that you could use to help study for these. I do listen to those sometimes on my commute. Also, chicagometrocuna.org. So our local chapter website does have a list of presentations that have been given over the years that would be good for studying.
Yeah, absolutely. And my big comment is when you're taking a test or studying for a test, the things that you never heard of, that's what you need to study. So as you're kind of listening through something and, like stone disease, and you're like, I know everything there is to know about stone disease. I don't study for it. Don't waste your time filling up on stuff you don't need to know.
Right.
Work on the things you don't.
Right. At least review it though, because there's always new things, so I wouldn't want you to say, don't study that at all, but go through it and review it. And then if you know it, you don't have to go back and keep studying it. Yeah.
Neil says the CBUNA website says that retesting after failing is at a reduced cost for a year.
Right.
Thanks for looking that up for us, Neil. So that's, again, I think it takes a little bit of the fear of failing out of it. If you take the test and you don't pass, then take it again.
And they started offering that because of the fact that we went computer based. So it's you wouldn't want someone to be able to take the test 2 or 3 times if it was going to be the same test year after year after year. So since we know it's going to be scrambled and different every time someone takes it, it's a good opportunity.
Well, it's been a great talk here today. I do want to mention that next week our subject's going to be taking a deep dive into urodynamics. And I did a recent presentation on urodynamics for our local chapter. And one of the things I discovered or recognized is whenever you're trying to talk about something for an hour, you're really trying to cram a lot of information into a short period of time. So one of the things I like about Uronurse is that it gives us the opportunity to take that deep dive into the subject matter and really go into it. So I'm going to break it into at least 2 parts, maybe 3, depending on how things go. But 2 parts for sure. The first part is going to be really taking a deep dive in how the test is done, things you should know to do the test properly. And then the second one will be looking more at how do you actually look at interpreting what data the test is showing. So I encourage you to tune in for our deep dive into urodynamics starting next week. Also, for those of you who have not had enough of our fun and want to come and keep the party going, there's always the after party. Go to uronurse.com, click on this picture, and instantly get transported into our Zoom room to go and chat with your microphone and video if you want on. It's always accessible for everybody. And at this point, I would like to thank everybody. We hit our 10 o'clock time and we're going to move on to our year after party. But Kathy, thanks for that presentation. It was really great to have you present on that.
Thanks for inviting me, Vic.
Took a lot of the fear out of it for some people out there. And of course, the on-demand audience will be watching this and they can utilize this as something in the back of their head when they're getting ready to certify. Andrea, always a pleasure having you on, and keep keep rocking that shirt.
Thanks. I'd like to end today with a quote from Florence Nightingale. I love her quotes. Let us never consider ourselves finished nurses. We must be learning all of our lives.
Absolutely.
Wonderful.
All righty. Hope to see a lot of you next week and have a great day.
Bye-bye.